Good evening, everyone, and welcome to tonight's webinar, Helping Families Plan Ahead, Inactive Trust Options, and Purchasing a Prepaid Burial Policy. I am Gabby Mansell, and I'm a family navigator here with the St. Louis ARC. So without further ado, I will turn it over to Casie Stevens.
Hi, everybody. My name is Casie Stevens, and I'm with Midwest Special Needs Trust. And while I'm getting my screen on here, I want to thank you all for joining me in this workshop. And I really am looking forward to spending our evening together, hopefully learning just a little bit more about why we should plan for our loved ones and what that looks like, including a couple of options. So this evening, we're going to cover a lot. And by a lot, I mean a lot, right? So you can see that this outline for this evening is why do we plan? We're going to do the briefest overview on government benefits and special needs trusts. We're also going to talk about an inactive trust option. We're going to talk about irrevocable prepaid burial policies. And then if we have time, we're going to talk about other options and considerations that we want to maybe put into our toolbox, right? Put into what can we do? What is there else to do? And what do I need to think about? Before we get started, I do want to say these are not easy conversations that we're going to have. These aren't easy decisions that we're going to be making. And this is not fun or exciting, right? This is one of the more somber discussions that we talk about. And so I do want to kind of fair warn you that some of this can be a sensitive matter, and that I don't want to bum anybody out on the holiday season, but it is important to think about. And that is because we want to answer the question, why do we plan? Have you considered, as a family member of an individual with a disability, and when I give examples, I use the name Johnny. So if you are Johnny's parents and Johnny has a disability, what happens when you're gone? Do you have a plan? And so I really want you to consider that. I want you to think about it, and hopefully I'm able to answer some questions. Why do we plan? Why does the St. Louis ARC put on these workshops for families to learn more? And it's because there are ways to plan and preserve benefits, right? 40 years ago, there wasn't much out there. 20 years ago when I started, it was still, you should disinherit your loved one. Those aren't things anymore, right? There is an actual mechanic to save and preserve benefits and plan for our loved ones with disabilities. And you say, oh, okay, Casie, but my family will take care of that. They'll take care of Johnny. Don't worry. That's great. But I'm going to be really, really honest, right? Because we're going to be honest tonight, and we're going to have the difficult conversations. We can't always trust our family, friends, or others to take care of our loved ones. We can't promise that when we're gone, that they're going to follow what we wanted them to do, right? So if we put it in writing, we put it in special needs trust, we put it in very specific language to protect public benefits, then at least you have some security to know that they have to follow that trust document. They have to follow the rules based in that document saying that they have to do that, right? We can't leave money to sister to take care of Johnny. That has all kinds of legal implications that I won't get into, right? So even though our family members may love their brother, sister, cousin, it doesn't mean that they're always going to be available to take care of them in the way that we hope they would. Because we want to provide for our loved ones with a disability, no matter what their ability. We want to support them for as long as they're here, right? We want to support their dreams, their education, their supported living situations, their hobbies, the camps, right? We want to be able to do that because there's not other funding sources necessarily for that, right? And because it's important, because we can. We don't want to leave out Johnny just because Johnny has a disability, right? It's important that we incorporate him and our family into our whole plan. And so we plan ultimately because it's important, and we plan because we don't know what's going to happen tomorrow. Right? We're having these very kind of somber, difficult, honest conversations this evening because we don't know what tomorrow brings. And so part of that is we want to make sure that in everything we do, in our special needs plan, in our special needs planning, our special needs trust, or whatever we're going to do, that we are protecting public benefits. And so I am going to do a very, very, very brief overview of public benefits, and I'm going to quickly move through my slides. These slides are on this presentation, and there's on another one that I do go more into depth on. So we are only going to talk about means tested benefits. So we are preserving means tested. That means benefits are based on an individual's income and assets. Means tested benefits include SSI, which is supplemental security income, Medicaid, including all Medicaid waiver services, HUD housing, and food stamps. So you may hear Social Security and Medicare. We're not talking about those this evening. We are only talking about means tested. And like I said, it's going to be quick. When I talk about income and assets, this is what I mean. Income is an amount a person receives each month, whether that be in wages, Social Security benefits, and sometimes even housing can count as income. And when I talk about assets, it's the amount a person has saved each month. And that saving is in their checking account, their savings account, and even their personal property can count as an asset. So we have income, which is money coming in every month, and we have assets, which is kind of money or property saved every month. And those means tested benefits are looking at income and assets. So when I talk about government benefits, when I talk about public benefits and preserving those, I am primarily talking about SSI and Medicaid. And this is just a little bit information, but when I talk about Medicaid, I mean Mo Health Net, I mean waiver services. That is all encompassing in this conversation. We aren't going to dive too deep into what government benefits are and why we need them, but we know we need to protect them, right? Because Johnny needs them. So we'll move on. So special needs trust, and this presentation, this workshop is not primarily on special needs trust. It's on a very specific type of special needs trust, but it is not an overview of special needs trust. I know there are other really great workshops that the St. Louis ARC has posted, but we're going to do a brief overview and we're going to talk about special needs trust. So they are essentially a financial planning tool, right? Why do we plan for our loved one with a disability? How do we do that? A special needs trust is a planning tool. It is utilized for supplemental needs, not basic support. And what that means is, and we'll go over it, what that means is it cannot provide housing or food to our loved one. It can only pay for, we talked about, their dreams, their camps, their hobbies, their supplemental housing. So if they needed a private room, it could pay for that. So not basic support, supplemental needs. This is how we are going to provide Johnny a way to continue to support him when we're gone, right? We're going to plan for Johnny right now so that there is a plan in place when we're gone. A special needs trust is governed by trust language and applicable statutes. And the most important part, if we remember nothing, I say this every time, if we remember nothing else I said this evening, it's that, one, we're having a very difficult conversation, right? We're talking about death. and planning for the future and what happens when I'm gone. And 2, special needs trusts are considered an exempt asset for SSI, Medicaid, food stamps, and HUD housing, right? Those are benefits. Those are public benefits that Johnny uses, and we must protect those benefits. The way to do that is a properly drafted and administered special needs trust. There are lots of options for that. There are attorneys, there are banks and pooled trust organizations. That's what MS&T is. This is what I do every day, is I administer special needs trusts, are all options. So we've learned that special needs trusts are a financial planning tool. They can be used a certain way, but the most important thing we've learned is that they are considered an exempt asset for SSI, Medicaid, food stamps, and HUD housing. There are 3 different kinds of special needs trusts. There is a first party trust, which I'm not providing information on. If Johnny were to receive funds directly and he thought that might impact his benefits, he could put that into a first party trust. But again, I'm not going over that this evening because we're talking about pre-planning, right? We're talking about what's going to happen when I'm gone. Who takes care of Johnny? What can I do now? And so we're going to talk about 2 options, one being a third party special needs trust and one being an inactive trust. A third party trust, and they're essentially the same thing, just one is funded later. So a third party trust is established by the donor. So this isn't Johnny's money, right? These are our funds for Johnny. These are usually personal funds, life insurance policies, and wills. Often leave beneficiaries to the special needs trust, right? To the special needs trust of Johnny Jones. And that means Johnny's not going to get it directly. It's going to bypass him. It's going to go into this well-drafted and will be very well administered special needs trust. And so there's no impact to his benefits. Going around him, right? It's going around Johnny. It's going from the life insurance policy to the special needs trust. Third party trusts can be revocable or irrevocable, and they do not require any Medicaid payback. And I don't touch on Medicaid payback. I do in my other workshops, but what that means is that these funds can be left to whomever you want after the beneficiary's death. So if there's a nonprofit that you want to leave funds to, or if there's other family members that you want to leave funds to, a third party trust can do that for you. So a third party trust funded with somebody's funds other than the beneficiaries. They are funded usually at the death of the donor. There's no Medicaid payback, which means we can distribute funds to whomever we want after the beneficiary's death. So the option for a third party trust, and when I say third party trust, I know folks are like, oh, that sounds so expensive. Oh, Casie, not only are we talking about death, we're talking about multiple zeros after that dollar sign, right? It is expensive. I get it. Planning is expensive. However, there is a low cost option for us to plan for Johnny right now that is not expensive. So an inactive trust is established by the parents, grandparents, friends, family, whomever wants to give. It's very much the same as a third party trust. There are personal funds. Usually these are the life insurance policies, wills, estates, all pay into an inactive trust at the donor's death, right? So what happens is all of the paperwork's filled out. It's there. The Johnny Jones Special Needs Trust is sitting there. All of the paperwork is done. Everything is signed, but it's not funded, right? Because the donors haven't passed. So what do? We wait until the donors pass and life insurance is writing a check, and they're going to see the beneficiaries listed as the Johnny Jones Special Needs Trust. And they're going to write a check to the Special Needs Trust. And at that time, the inactive trust becomes active. It is ready to pay for Johnny's supplemental needs. So in my world at Midwest Special Needs Trust, and I do want to talk just a little bit about us at the end. In my world, an inactive trust is $200, a very, very low cost option to have Johnny's life and his dreams, his wants, his hobbies all paid for when you're gone for $200. You list him on the life insurance as a beneficiary, and it sits there until you're passing. And you can be assured that his supplemental needs are met. Johnny's supplemental needs are met for $200. Right. There are attorneys and there are other trust companies that will write a special needs trust, and they will have a very similar option. And that's great. I always encourage you to explore the options to find out what's best for you. What I'm going to tell you though is those options are expensive. And this like I said is $200. Which may seem like a lot of money, and it can be. But when you are looking at 200 compared to 2,000 to have an attorney draft a special needs trust, there's a big difference there, right? So how does an inactive trust answer our questions, right? Why would we use an inactive trust? Why would we use a special needs trust? Because we can. Is the easy answer, right? We can. 40 years ago, there really wasn't a mechanism to do this. There were two-draw trusts, and that was probably 35, 40 years ago. MS&T has been around for 35 years. So at least 35 years, there's been a way for us to save for our loved ones. And so we should, right? The special needs trust, if drafted and administered properly, are going to preserve benefits. They're going to tell family members how the trust can be used, what they can and can't do to make sure that it is that they are serving the role that you want them to serve. Because we want to provide, right? We want to be able to send Johnny to camp every summer. We want to be able to pay for his supplemental needs. And it's important, right? It's important that we do this. It's important that we plan for our loved ones, because again, we don't know what happens tomorrow. We don't know what tomorrow brings. And so this is a very cost-efficient way to plan for our loved one while we're still living and without impacting any benefits. And I do have a very, very quick list of what's allowable and not allowable. And so you heard me say we can't pay for, special needs trusts can't pay for housing, food, we can't pay for cash. Some trustees may not allow some of these other items, but what we're really looking at is that allowable list with medical, dental, therapies, education, clothing, all household needs, transportation, home modifications, hobbies, entertainment. All of those are allowable expenses, and this isn't the whole list. Right. I'm going to get to irrevocable prepaid burial policies, and you all are going to hear me lecture on this very difficult topic, but we're going to talk about it here in just a moment. But I want to make it really clear that you have a special needs trust and you have it set up for Johnny, and sister is the trustee. Sister needs to know she can't pay for Johnny's housing. Right. That's going to impact those public benefits we talked about earlier. That's going to impact those means tested benefits. She can't pay for Johnny. She can't give Johnny cash. That's going to count as income. That special needs trust can't pay for her and her kids to go to Disney. It can only pay for Johnny and a caregiver to go to Disney. So there are some things that when we are, and we're going to talk about this in just a little bit, when we are considering who's a trustee, what those roles are, that our trustees know how a special needs trust can or cannot be used. So before I move on to talking about irrevocable prepaid burial policies, do we have any questions either about why we plan or public benefits or special needs trusts in general?
Yes, we have a question that asks, when would you choose to utilize a special needs trust versus an inactive trust?
So it really just depends on your situation. So you can make a special needs trust active. You can fund it right now if you have those available funds and start using it for Johnny. The inactive really serves a really great purpose if those funds aren't available for Johnny right now, but they will be at your death. And so I always recommend an inactive, but if a third party is something that grandma and grandpa want to do, aunt and uncle all want to send birthday and Christmas money and put it in a third party, absolutely, you can do that. All right, so we are going to move on. You can see this list of allowable expenses has irrevocable prepaid burial policies. If you have ever heard me speak before, what I say is I'm going to get on my soapbox and I'm going to talk about the importance of irrevocable prepaid burial policies. So a special needs trust cannot, and I repeat, cannot be used to purchase a burial policy, cannot be used to purchase funerals at the death of the beneficiary. Beneficiary uses their trust. They get to go to all of the camps and do all of the hobbies and have wonderful travel. And then they sadly pass away. Trust turns off. Trust can't be used to pay for the funeral costs. Maybe we didn't have a special needs trust. Okay, that's fine too. We had different plans and that's great. As long as we have a plan and we know what that is. And Johnny passes away. Mom and dad are gone. We're gone. And Johnny suddenly passes away. Pays for the funeral costs. Right? Do we leave an $8,500 expense on our other children? Really want you to think about it, because it is so important. So Medicaid and SSI allow for $1,500 to be set aside for burial costs only. Okay, so you can have $1,500. Johnny can have $1,500 set aside for burial costs. You must prove that they're for burial costs, but they can be for burial costs. But if he were to take that $1,500, put it in an irrevocable prepaid burial policy, and added money to it throughout, there's no upper limit. You can do the same. You can go to the funeral home tomorrow and say, I want a Medicaid compliant prepaid burial policy. They're going to know exactly what that means. And they're going to fill out the paperwork and make a payment or put it on a payment plan, right? There is no upper limit in Missouri on how much can be in an irrevocable prepaid burial policy. So you can have 5,000, 10,000, 15,000, 20, 25,000 for irrevocable prepaid burial policies. And when I say prepaid burial policies, I'm all encompassing, right? So funeral costs, burial costs, headstone, gravesite, opening and closing, the memorial cards, the videos, the flowers, the reverend, the embalming, all of that can be included, and all of that adds up, right? I've been doing this about 20 years. 20 years ago, I would have told you the average cost of a burial policy was about $7,500. I'm going to tell you now, this is a low number. When I saw 85 yesterday or the day before when I was working to confirm the amount of an average price, I thought that was kind of low. I would probably, based off my experience, say 10,000 is the average cost for a funeral. So we want to make sure that in our plan, we know how Johnny's funeral and burial expenses are going to be paid. My favorite option is an irrevocable prepaid burial policy. I don't want to burden my other family members for that cost. I don't have anything set aside for Johnny right now. I want to do this now. And maybe if Johnny's capable and we want them to be involved, and he wants to be involved and he can make those decisions or be a part of that decision making, involve him. Involve your loved one. What are their final wishes? Right? And I said this is not going to be an easy conversation. We are not having fun this evening, right? This is honest, very, very difficult to think about, to talk about, and to consider. However, we do not know what tomorrow brings. We have to start thinking about these things now. Nothing else, jotting them down on a piece of paper. We need to talk about what we want for Johnny, how that looks like, who we need to talk to, what do we think the costs are going to be, so that, and then we need to talk about it with our families, right? They need to know, are they a part of the plan or are they not? If they're a part of the plan, what's their role? Do they want to serve in that role? We have to start having these conversations. We have to know that Johnny's needs and his supplemental needs, if we're talking a special needs trust, are taken care of, that his public benefits are protected when we're gone. I do want to stop here before I jump to my next slide and see if anybody has any questions about irrevocable prepaid burial policies.
One of our questions is, does that mean that the price does not change, meaning current dollars?
Correct. So if you buy a policy, an irrevocable prepaid burial policy for $10,000, everything in there is paid for. Now, when Johnny passes away, they're going to say, you have $10,000. This is what was paid for. And your family at that time can choose to do more. But essentially, you've paid $10,000 toward the funeral costs, and this is what's covered. I would not recommend a revocable because
Okay.
that is going to count as an asset. In fact, I've seen it where somebody had a revocable policy and it was only $2,500 and it kicked them right off their SSI. So you always want to make it irrevocable.
Okay. And the last one I'll ask you before we move on is, if we set up an irrevocable prepaid plan in one city but later move to another part of the country, do we lose the dollars for that original prepaid plan, or is there refundability or transferability to another location?
So likely it's non-transferable, but you can, depending on who it's purchased through, like there's an insurance that actually pays for it. You should be able to talk to your new local funeral home and get those services covered under that plan. The other thing is any kind of transportation of the body is an allowable expense to put into a policy as well. So maybe Johnny moved, but you still want him buried with the family. You can actually have that built into the cost of the funeral. I've not had any difficulty with funeral homes covering the cost if a beneficiary is moved. So usually it says non-transferable, but there are some ways that the funeral homes can work together to cover those costs.